supporting letter is quite a strong piece of evidence to say how your child is coping and what your needs are and why you need that, and those letters have to be strong. I would say again, come to the society, because we have direct links and we're able to go through the application process with you, but also when you have those calls, we can sit into those calls and make sure that the questions you're asking is appropriate and that you're having the right things picked up. So that's a process. I can't speak for Sickle, but I can talk for Thal here. That's something that we've set up within the charity.
Thank you. Thanks, Roanna. Okay. Yep.
Yeah, hi. My concern is about the employment, because of in terms of the treatment. I just want to take opportunity to thank my North Mid Hospital doctor and the nurse Halvin. They're really nice. So yeah.
That's very sweet.
I just want to thank them.
Where's Olive there? Oh, Alvin.
Yeah,
that's lovely.
They are superstars. But my question is about the employment. So because I got 2 kids with sickle cell, and then the pain and then the discomfort and everything just kick. You don't tell. It just come, and then when you are at work, they call you. You have to come back home, and then the following day you don't go to work. You have to skip work so many times, and then when you are in hospital, you don't go to work. So it's not about yourself that you can bring the the sick note to tell them I was sick, and then they will write to you. But it's about them. So is there any law? Is there anything there so I can tell you to work, because I have to change your work because of excuses all the time? So I've been to the hospital. So what shall I do about that?
I'm gonna come to.
Okay. I think the issue is similar to what you have in schools, because again with the employers, even in terms of whatever the organization is, it boils down to maybe like the particular place where you're working. In particular, maybe it might be your manager or whatever. Because what we try and do is give information. But at the end of the day, it's down to them to take the information and say we are willing to make adjustments in the workplace for that individual. So with whatever guidance that we give, we still have to, as health professionals, also provide additional support information for that individual person. But it really boils down to the individuals that people are working with. So for example, before COVID, I was trying to make a case for at least a couple of people to be able to work from home, because they could work from home. That wasn't agreed. But when COVID came, they realized that, you can work from home. And since then, that has been, something in place that has helped. So I think, unfortunately, it goes down to individual cases that we have to try and support. But employers as a whole, I don't even think that, even within the NHS Trust, my NHS Trust are sympathetic to people with sickle cell or Thal, because they put so many impediments in their way that we have to go and advocate for them. And I think that is just what it is.
Make sure that on your employment record and with your line manager, you are down as a carer, one, because that gives you then additional reasonable adjustment, additional absence leave record exemptions because you're a carer. That also means that you have to speak to your line manager and educate them about what type of condition your child has, how sporadic and random some of the events might be, and get some support from the Sickle Cell Society or other organisations that work around employment. They've got things around employment law that they can support you with as well, but it's part of your reasonable adjustment as a carer.
Thank you. Thanks so much. So we've got last question.
Yeah, just quickly, I wanted to ask about the future of sickle cell kind of treatment. Should it be more early intervention? I know Ben mentioned about us having options, BMT or gene editing, but like she said, unless your child is, like my daughter is 13 now, she's gone through the last really horrible 2 years, and we keep being told by St. Mary's, we live in Cambridge, like Peterborough, and they're saying St. Mary's are assessing, we were not had for 2 years, she's not been tested for a bone, like a March, we don't know what's going on. Okay. So if the future is early intervention with these options that are hopefully curative, that will be good, better quality of life, but also money saved for the NHS, not going through all these years of so much medication and quite a lot of expensive things that could hopefully, if we offer these options early and the children are okay, they might not need to be in hospital all the time.
Okay, so I'm actually going to come to Martin for this one because so I think the question is about improving health in childhood, early interventions, what treatments are available. So one of the difficulties with treating children is that it takes a long time to get any new drugs that are tested in adults first before they will be tested in children, deemed safe, and then be available for children. So I'm going to come to Martin to tell us a bit about the future. How do we keep children healthy so we give you healthier adults?
Okay, thank you. So I'm an adult doctor, so I'll answer the question as best as I can. Essentially, the only preventative treatment we have in sickle cell at the moment is transfusion and hydroxycarbamide. And the other care is supportive. We have vaccinations, we have penicillin, we have folic acid, and we have good supportive care, all the measures about hydration, keeping warm, making sure the challenges that children and young adults face are appropriate and nobody is feeling that they have to take excessive risks. But in terms of the treatments that are currently available to us, unfortunately, we only have hydroxycarbamide. And hydroxycarbamide is an extremely important treatment, but it requires a lot of patience. And I have many patients who've spent many years in my clinic not wanting to try it, but once they've managed to come through the tunnel and try it out, they don't want to be without it. We're hoping that there are new treatments available soon, and we've all seen the disappointment of Voxelotor and now the uncertainty whether it will make a comeback or not. We've had the fresh hope with crizanlizumab, which then unfortunately also was unfulfilled, and we have people at the moment who are sort of in limbo with hydroxycarbamide on the one side, transfusion on the other, but nothing in between other than the stem cell transplant for the extreme cases. There are some very promising treatments in trial, such as pyruvate kinase activators. So there's 2 coming through, made by different companies, which have the hope of both raising hemoglobin and reducing pain. But all of these things, it's a bit like a game of snakes and ladders. You have to make the best strategy for each individual in terms of finding the right tool for the right job. Some people may be so rarely affected by crisis that just the right supportive care, folic acid vaccination is enough. And we also need to be more open and honest about the long-term damage that untreated sickle cell does. And if everyone knew how sickle cell and these minor crises affects our health throughout our lifetime, I think more people would be willing to try hydroxycarbamide. So at the moment we have hydroxycarbamide, we have transfusion, we have gene therapy and stem cell transplant, and we're hoping that maybe by the end of 2025 we're expecting some more results from trials, and also by the end of this year we're hoping to hear about some drugs like inclacumab, which are supposed to have finished a trial, but at the moment that's what we've got.
Thank you, Martin. I would just say also, just to be aware that if you have SS or S-beta-0 thalassemia, your clinicians should be discussing that by the age of 9 months we should have offered, and those of us who are firm believers in the benefit of hydroxycarbamide would say we recommend hydroxycarbamide to be started by 9 months of age. So if you've not had those conversations, even if you've got babies very recently diagnosed, then please do ask about that. I am going to, with that, draw this to a close and say a huge thank you to our amazing panel. Before you all peel off, I just have a few announcements. We just wanted to say, so that lunch is here, it's all free. when we've got some feedback forms, please do tell us what's gone well today, what you'd like to see more of. If you're interested in telling us about your experience of care and helping us do better as a network and as individual hospitals, please leave your contact details and we will be in touch about ways that you can do that. You'll get the wristband to go into the zoo, but at 3:30 there's more tea, refreshments, and we're doing the prizes for the drawing competition, so that will be back in here. In terms of what else is going on, so if you are in secondary school or above, there are going to be some transition workshops, so please do sign up for those, for parent carers and for young people, and that would be just to come and meet here, congregate here please. And last but not least is to say a huge thank you to the amazing team that have put today on. Bernadette, who has stolen someone's baby. I can only hope that the parents are fully aware. Bernadette, our amazing nurse specialist and lead nurse educator. Chris, super Chris, thank you. Stuart, who for some reason is on his knees in the corner. And then Cal, who is somewhere around. Stuart's our network manager. He makes